Now we are in Atria Mall, Damansara, and what are we doing here? We are here to talk about dementia. Now today's episode will be focusing on the disease that has affected 50 million people worldwide, and 50% of that, 25 million from the Asia Pacific region. Now we'll be talking how we are going to manage this disease globally and also what we Malaysians can do for this disease. Join me, this is Health Matters with me, Dishen Kumar. All right, thank you Paola for joining us today. We have to ask, what does Alzheimer's Disease International actually do?
Thank you, Dishen. Alzheimer's Disease International has existed since the 80s. It was founded originally by the 4 largest Alzheimer's organizations when they realized that unless they pulled together and unless they started advocating for dementia and Alzheimer's at international level, the UN, the WHO would never really listen about dementia and what dementia was about to become. And now we know it's such a giant disease, such an epidemic of enormous proportion. What we do really is being a membership organization. So we work with 94 countries. We can only have 1 member per country. Our country member usually is the largest or the most established or the most known Alzheimer or dementia organization in that country. And we act as a central secretariat. We actually produce, we publish a lot of material. We organize World Alzheimer's Month, World Alzheimer's Day, the World Alzheimer's Report, and we publish the figures globally on the incidence and prevalence of dementia. This has given us a really good view of what is actually happening country by country. And we are particularly concerned with countries that are in lower and middle income brackets, because we want dementia to be a global problem, a problem that everybody knows about and that we all try to find a solution for together.
Now the statistics for dementia is staggering. 50 million people suffer globally, and 25 million or 50% of the people are from the Asia Pacific region. Now why is that?
Well, one of the reasons why Asia Pacific is more prevalent is clearly that Asia Pacific is aging more than other regions. So dementia is actually not age related. You can be diagnosed with dementia very young, unfortunately. But certainly after 65, your risk to be diagnosed with dementia is much higher. And in Asia Pacific, there is a higher percentage of people who are in that category of risk. So the problem in Asia actually is becoming larger as, fortunately, we are all living longer. But that means that the amount of people with dementia is getting larger. There are other factors, but I would pinpoint to that probably as the most obvious one.
Now, Paola, when we talk about dementia, what actually are we talking about? What are the symptoms, and how can dementia actually be a cause of death?
Dementia is an extremely complex disease, and in its pure form, dementia is a deadly disease. So if you have dementia and you don't have anything else, eventually, unfortunately, you will die of dementia. However, because usually it's contracted later in life, often people with dementia present other illnesses, other diseases, what we call comorbidities. So they actually often have cardiovascular, hypertension issues, diabetes. They can have issue with having had falls and fractures. So it is sometimes the case that you can have dementia as an underlying condition and a whole host of other conditions that can either have given rise to dementia. They can be factors that have contributed to you getting dementia in the first place, or they can be a consequence of dementia, like for example in the case of falls, you can display that. Dementia unfortunately kills you, to get back to your original question, because it's a progressive neurodegenerative disorder, and that means that progressively the plaque and tangles that characterizes dementia move to cover your own brain until effectively your brain cannot function anymore. And of course, if a brain cannot function, that eventually causes death.
Now, Paula, what are the variables which can determine whether someone may or may not develop dementia?
Okay, so there is certainly a number of risk factors that can determine whether a person will develop dementia. I would say that the most normal one are associated probably with cardiovascular. You can have, for example, cardiovascular dementia. However, there isn't really a typology, and often people ask me, if my grandparents had it, will I have it? Or if my grandparents didn't have it, does it mean that I will not develop it? And unfortunately, so far, there isn't a clear correlation. There is a few forms of dementia that are genetic, but they are very rare in comparison to the standard form, which is Alzheimer, Lewy body dementia, cardiovascular dementia, and frontotemporal, which are the most prevalent. There are 104 types of dementia, unfortunately. And for those forms, I cannot quite tell you, why people have them. However, there are many studies that are looking into that.
Are there a lot of research being trying to find if there are any factors involved in people getting dementia, or do you feel like there is not enough progress being done in research?
Well, this is two very good questions, two different questions. So yes, nowadays there is a lot more research done on how can you reduce your risk of getting dementia. And this is actually excellent news. One of these great studies has been done in Singapore, which is next door to Malaysia. So what the researchers are doing are studying large cohort of people and studying their 4 or 5 things, like their food intake, for example. They are looking at their exercise regime. They are looking at their socialization patterns and at the way that they utilize their brain. For example, education, or the fact that you use your brain constructively every day at work, you keep yourself occupied essentially, are wonderful ways to slow the cognitive deterioration. A brain that is not used is a brain that is, ripe to be taken over if the disease unfortunately takes place. So yes, a lot of these studies are happening, and they're looking at large cohort of people, because you really need to look a large group of people for a number of years in order for you to understand really what are the factors, especially dietary, that may be causing a slowing down or not getting it at all. There may be protection factors, it's just that we don't yet know about them. So this is happening, research is happening. I would like this research to happen all over the world. The researcher that is leading that is Finnish, and she is very keen to sort of try all over the world, and we very much hope that she will be able to do that. But that's not the only research happening. There are other pool of researchers all over the world studying into their own country. For example, in some countries, cardiovascular dementia is more prevalent, and you have to wonder why. If 75% of population generally gets Alzheimer, why some countries are getting more cardiovascular, which usually has got a much lower amount. So the research field is ripe for further study, yes.
I mean, there is a connection there, but people actually haven't
made it.
Made it there. All right, this has been Health Matters with me, Dishen Kumar. We are going for a short break. We'll be back right after this. Now, Paula, how is dementia being dealt with in countries across Asia?
Well, very differently. That is the answer. So certain countries are way more advanced than others. And I would put it in 2 different ways. There is an issue about acknowledging that you have a problem, and some countries are still in denial about having a problem. So around the world, not all countries have even acknowledged the existence of dementia as an issue in their country.
Okay.
And some other countries are really leading the way and telling us they have definitely acknowledged they have a big problem. And I would say in Asia, Japan and Korea are definitely doing the most. Japan has been a groundbreaking country where we are having this interview now, and we'll talk about it later. It's an example of some Japanese innovation being brought around the world. They have been great. Korea now are investing a huge amount of resources into getting the entirety of the population on risk reduction and prevention measures, on dealing with the care issue, on informing their population on a state, on a government scale. Some other countries, I'm afraid, are lagging behind. For example, we know that in Nepal it's been very, very difficult to make any progress. But some others are doing what they can within the means that are available to them. I think what you're doing now, raising awareness and informing your population about this, is one of the most important things we can do. Because actually, how can the population demand action if they don't even know that this is a disease? So we need to tell people, look, this is not old age. Your grandparents, in many cases, dementia is going to be dementia. It's not going to be them just growing older, and we have to do something about it.
All right, Paola, this is, I'm going to put you on the spot here. I have to ask you this question now. What is your opinion on the whole global initiative to say, let's do something about dementia? Why did it actually take so long?
Well, I think that in part is because the dementia movement as such didn't get it organized, it didn't organize itself soon enough. So if you look at cancer, their international body was set in the 30s, the dementia body was set in the 80s, so we missed pretty much 50 years in raising awareness. We are now looking at the examples of other healthcare movements like cancer, like AIDS, that have managed to attack our biggest enemy, and our biggest enemy is the stigma at the moment, as well as the disease itself. Because unfortunately, and all of your viewers will remember, 30 years ago, you know, if people thought they had cancer, they wouldn't want to get themselves diagnosed. Would you do that now? No, that would be a super stupid thing to do. You would want to go to your doctor straight away and ask for a diagnosis. So we need to get there with dementia. We need to get people demanding to know what they have and understanding. And sometimes people tell me, well, if there is no cure, then why would you want a diagnosis? Well, they're saying for cancer, not all cancer there is a cure, but you still would want to know what you have, because you can do a number of things, as in with dementia, to make your life much easier and your family life much easier as well. We advocate for research in dementia, and we've been talking about the pharmaceutical element, but actually there's a whole field of dementia research that looks into care. So you can make the environment of people with dementia much easier. You can look after the health of family members of people who have dementia, and that's very important. There is a huge amount of things you can do, for example, with rehabilitation. If people knew how much can be done, and in this center here where we're talking from, they do all kinds of sessions to help people with dementia acquire a number of mobility skills that will help them and will slow down their cognitive deterioration. So there's a lot that you can do. But yes, the Alzheimer movement got organized much later. And I think now there is more awareness, I think, globally, and people though are still fearing the disease rather than trying to find answer of what can they do about it. And that is true in higher income country and low income country alike. The ADI movement has always been global, so for us it's always been about getting in this together, learning from each other together, and in a lot of the country I go that people wouldn't necessarily think are, you know, very rich. I went to Costa Rica, for example, last year, and I saw one of their hospital program is the best I have ever seen, about training doctors and nurses in dementia and how to deal with environmental and personal issues in a sensitive manner, in a way that I haven't seen elsewhere. Today in Malaysia I saw a fabulous rehabilitation room, for example, and that was really nice to see. So each country really can contribute something to the debate. It's just about us putting everybody together to talk about it.
Now we have to talk about 2017. WHO actually made a global action plan for dementia across all countries. Now, Paola, can we discuss the 7 cross-cutting principles of that plan?
So the first thing about the Global Action Plan is that we at ADI have been waiting for years for this to happen and contributed very strongly for it to happen. So we are totally delighted with the 7 areas. So the first point of the action plan is the government must acknowledge they have a problem by raising policy issues within the government about how we're going to deal with a dementia epidemic. So being cognizant of the numbers, being cognizant of the care facilities that are offered in each country. Then awareness raising is the second point. So we were talking about before stigma awareness raising. It's very important that each country, according to the plan, take responsibility for public health. So essentially that is the main point. We can do so much. We organize World Alzheimer's Month, World Alzheimer's Day, we organize themes, but each country really needs to bring those themes more broadly into their entire population, because otherwise how can we know that we succeeded? And that is not just in the wider population, but also primary care doctors and nurses. So the first professionals that the person that thinks they may have dementia see. So not just the specialists. So everybody should know more about it. The third point is around the creation of a dementia-friendly world, if you want, a dementia-friendly society. So how can we make the environment more aware that dementia is something that exists, and instead of suggesting that people with dementia don't socialize, knowing full well that socialization is one of the elements that helps them keep happier for longer and live longer.
Accept them.
We may need to make everybody accept them, and this is what they're trying to do here in the Atrium Mall, and that's a wonderful thing to see. The fourth principle is around risk reduction. So a lot more has to be done about telling people what we were discussing before. You've got to exercise, you've got to eat healthily, because this is really going to develop more protection. And the good thing about it is also that many other non-communicable diseases have the same factors. So, you know, you get two pigeons with one stone, as we say in England. So it is a good thing to do. And then, of course, there is care. So care is what a lot of people are worried about with dementia, because care is what is so difficult to get right, and it can last for so many years with dementia. At the same time, as we said, the acute phase of dementia is often the last phase, but you can have many happy years in an environment that is caring and supportive for you, and that understand what it is that is good for you as a person. We are a very great advocate of person-centered care, so every person is different.
Right, this is Health Matters with me, Dishen Kumar. Very interesting conversation we have on dementia. We have to go for a short break. We'll be back right after this. Okay, we have to talk about Malaysia. Now, why does Malaysia need a National Dementia Plan?
Yes, the Malaysia needs a National Dementia Plan, just as every country needs a National Dementia Plan, because once your Minister of Health, and sometimes your Minister of Welfare or your Minister of Public Health get involved and get talking about these 7 points, then they have to decide on a budget. And so the important thing of plans is that plans are ways for governments to understand the cost underlying a disease management. So this is very important, because if the country doesn't understand the cost, how can they provide help for their population? So this is why we insist on a plan, because many countries try to look at dementia from the aging perspective. That's nice, but dementia is not just about aging. Or from a non-communicable diseases perspective, that's wonderful, but the pathways for clinical healthcare of dementia are very different from, say, the pathways of clinical healthcare for diabetes or for respiratory diseases. So dementia has to have its own pathway. Other countries look at it from different angles, from mental health, for example. Once again, lovely, and definitely there are elements of depression associated with that. However, that's not the whole story.
Yeah, nobody's actually talking about dementia as itself.
Exactly. So yesterday we did meet with the Ministry of Health of Malaysia, and we did talk about that, and also about how bringing some of this messaging together, about the 7 action points, about public health, about information, awareness raising. And they, as we progressed with this meeting, a very constructive, very good meeting, they realized, but actually we are doing some of these things already. So, and most countries are, it's just that they are not thinking about it that way, and they are not labeling it in a way in which then families can find support. I give you an example. Scotland, a few years ago, they really decided to go very heavily into the diagnostic system. They said, why are people not being diagnosed? And sometimes it's because you're lacking PET scanning facility, or because you're lacking specialists. Some countries don't have geriatricians or neurologists or psychiatrists. So they started looking at those resources, and crucially what they did, which nobody else had done, was to provide support for anyone that had been diagnosed and for their family. So after diagnosis, both the person who had been diagnosed and the family received practical support, help, counseling on all the elements that had to do with dementia, so that they could be prepared and understand what type of disease course they could expect. And that, for a family, and I understand that you have seen this yourself, and for a family that has dementia in their home, it's incredibly helpful, because then you know exactly what you need to do. And that will help you immensely understanding and also seeking the company of other people that have shared experience. I recently was in Israel, and somebody presented this wonderful video about people finding company, both people with dementia and caregivers finding company and places where they can share their experiences in daycare centers like this one. And that is precious to people when they realize their stories are not isolated, but they are part of a community of people that are all sharing the same background.
All right, final question. What does Alzheimer's Disease International want to achieve this year?
Well, for us, this year is very interesting because we have a great focus on regional work and a great focus on national work. So we are holding 6 regional meetings or conference. One of them will be in Malaysia in August, from the 18th to the 21st of August. ADFM, the Alzheimer's Disease Foundation Malaysia, will organize an a regional conference, with all of our regional members. So 18 members will come here, and then they will meet a lot of professionals from Malaysia and talk about dementia and share information. So as with Malaysia, we are doing the same in every other region of the world. This year is quite interesting for us because our World Alzheimer Report is going to be focused on stigma and awareness. So we really want to bring to the world this conundrum about stigma. So stigma is what people with dementia and their family suffer from. They sometimes feel isolated, or they feel that they are ashamed, that they don't feel that they want to talk to other people about what's happening to them. And this has to stop, because unless we all know that we have a shared problem, and there are an estimated 123,000 people with dementia in Malaysia, so imagine how many more people in their family are aware of this and are talking to each other. So, you know, there's a lot of people in Malaysia that have this, and we can all have a conversation about it. On the other hand, we also want to poll the general awareness in the public. So we'll ask, for example, our member in Malaysia to do some public polling about how much people understand that dementia is a disease and is not just part of aging. So we are commissioning this piece of research both to a university and to our members to do, and we are hoping to publish the result in September. So at that time, Dishen, if you want to do a program on World Alzheimer's Month, we will be delighted, because we'll have some really nice taglines and Twitter feeds and social media and things that people can do, and waving balloons and flags and t-shirts in the typical Alzheimer's Disease International fashion. We'll do more of that.
All right. Thank you so much, Paola, for your time.
Thank you very much, Dishen.
Now, this has been Health Matters with me, Dishen Kumar, and we have talked to CEO of Alzheimer's Disease International, Paola Barbarino, a lot. The whole conversation was about dementia and the whole global progress. Now, what we can do as Malaysians is to increase our exposure on the disease, and also if you have a person suffering from dementia, please get help. It's never too late. Dementia can be managed. We'll see you on the next episode. My name is Dishen Kumar. Thank you. Goodbye.